name is Jelly Garner, and today I'm going to be changing an Ostomy appliance. I have already introduced myself to my patient, verified name and date of birth. I have done my assessment, asked for any pain, or assessed for any pain, any discomfort, any irritation around the ostomy site, or anything like that. All of that has been denied. So I'm going to go ahead and perform hand hygiene. And I do only have one pair of gloves, so I will just verbalize where I would change my gloves. So I'm going to don my clean gloves. And since these are clean gloves, not sterile gloves, I'm not going to put them on like sterile gloves. And I'm going to move the cover back and expose the ostomy bag and appliance and things like that. I'm going to grab a clean bath towel, put it underneath the ostomy bag, just to prevent, if there is any drainage or anything, not to get it all over the patient or all over the bed, things like that. And now that I do have this in place, I'm going to move the sheets back some more, trying to maintain patient privacy as best as possible. Now, if this were an undrainable bag, then I would just take it off and dispose of it according to agency policy in a biohazard container, things like that. But this bag can be emptied, so I'm going to grab a bedpan. Going to empty the bag like so. And I do need to save this clip. I'm going to stick it in my pocket. And after it is emptied, we'll remove the bag and discard of it in a plastic container. But I do not have a plastic container, so I'm just going to set it, or my plastic container's on the ground. I'm going to take the bedpan and clean it, disinfect it and stuff like that, so I'm going to set it on the side. And now I would remove my gloves, perform hand hygiene, and put new gloves on, and I would get a adhesive remover, gentle adhesive remover for the patient's skin, and to take the wafer off. Trying to be gentle and make sure that there's no skin folds around the ostomy side or anything like that. I would have already checked for that before I began, but just to verbalize. And I would be using that adhesive remover the whole way around, pulling off as gently as possible. Make sure there's no stomal irritation, anything like that. And I would discard this as well in the plastic container. And then I can remove these gloves, perform hand hygiene, but like I said, I'm going to keep them on. And I would inspect the stoma, the skin around the stoma for any irritation, any redness. The stoma should be like beefy red or like bright red or pink in color. And then I am going to put a cleanser on the skin with a pH of 5.5 to get the stickiness away and cleanse around the skin. And then I am going to grab my new supplies. Sorry, just had to step off to the side to get my new supplies. So I would start by getting I would measure the stoma. So it looks like this stoma is 1 1/2 inch. So I'm going to cut the wafer a little bit bigger than that, with 1.5 to 3 centimeters bigger around the whole thing. This wafer is pre-cut to as big as I need it, as you can tell. So typically I would cut it, but this is the only wafer in the room right now. So I am just going to use this one. And then I'm going to go ahead and peel back and discard. And then I'm going to place this around the stoma site. Would make sure that there's no pain or discomfort. And if I was having issues with the stoma sticking, there are measures, or not the stoma, the wafer, there are measures that I can use to allow it to stick. And yes, the area is already cleaned. This ostomy bag does have a clamp on it, so I'm just going to use this one, and then you just put this around it. Make sure that the seal is good. Obviously, I'm not going to tug on it too hard or anything like that, but make sure that there is a good seal and it's not going to go anywhere. I'm going to remove the bath towel, which was in place in case of any leakage, and then move the gown down, this up. And make sure that I have the call light placed in reach, and if the patient needs anything, obviously she can contact me, and I would just come back in to check it every couple hours or so, or if there was a complaint. So thank you.